Yeah, I really am pleased with, the almost an enthusiasm in our community for trying to follow the rules and do the right thing, and people thinking about their neighbors, their friends, their loved ones, and doing the right thing. I'm not sure we've seen that all over the country, but here in West Virginia, I think we have.
Man, it's one thing to help your neighbor out of the ditch when they slide over in the snow. It's another thing to potentially save their life. Hello, I'm Alex Rennan with Unleashed Tiger. I'm here with Dr. Bender, Taylor County Health Officer. Dr. Bender, thanks again for coming on the program and giving us an update on what's happening with COVID-19 in our community.
Sure, Alex. I'm glad to be here.
Hey, I want to start out with it's kind of been a challenge for many of us through this epidemic from the beginning, or the pandemic from the beginning, and even now. Is what would you say to those who are saying the cure has been worse than the disease, with things going on with the economy and jobs lost and those things? And is it really, now we see we haven't had that many people infected? Has this all been overblown? What do you say to those folks, and how can we address their concerns in what we're seeing now?
Now, Alex, we're seeing the effects of our mitigation. If we hadn't mitigated this disease and done the things that we've done as a country and a state, we would be in a lot worse shape. Those models that we look at would be showing us that many, many more people would be suffering and dying, and we would have a surge that those of us in healthcare just could not hold back.
Yeah. And, I guess I empathize with some of that, because I do, it unfortunately, when the government takes rights, they tend to not want to give them back. So I get the concern. You look at the Patriot Act and those kind of things. So I think as a public, we should be concerned about those things, and let's watch as we get through this. And I do think most people, even those that have concerns and disagree, are following the rules. I mean, I've seen our community. It looks like we're doing a heck of a job. And I think that's a testament to people wanting to take care of their neighbors, which is what we've seen here.
Yeah. I really am pleased with, the almost an enthusiasm in our community for trying to follow the rules and do the right thing, and people thinking about their neighbors, their friends, their loved ones, and doing the right thing. I'm not sure we've seen that all over the country, but here in West Virginia, I think we have.
Man, it's one thing to help your neighbor out of the ditch when they slide over in the snow. It's another thing to potentially save their life. And I think we've all been given the chance to save each other's lives. And it's pretty powerful. And you see it happen on a daily basis. So when we talked last time, it was still kind of early. I don't even know if we had a West Virginia case yet.
I don't know.
Well, certainly not a Taylor County case. I know that for sure. Now we've got it. We've got a couple. What have we learned since we last spoke? I mean, I know there's mask recommendations now and other things. Can you kind of get us up to speed on the latest and greatest that we need to be thinking about in regards to COVID-19?
Yeah. So since we talked last time, we certainly see that folks have to act differently than they were acting before, and they have. We see masks in public. I remember I went out about 2 weeks ago with my mask on, and people were looking like, why do you have a mask on? Well, now you go outside and everyone has a mask on. We just know that maybe the mask doesn't protect us, but it may protect someone else. If we have a cough or a sneeze, we'll keep our droplet inside our mask. So it's a good thing. I think we're seeing that the effects of our stand in place here in West Virginia have done what they're supposed to do. We haven't had a surge to this point in the number of cases, and so we may be able to recover a little more quickly because of that. So I think that's what we've seen here. Some changes in what folks how they live, and from a day-to-day basis, and we now understand the whole stand in place and how that can positively impact us.
Yeah, and I'll tell you, I've always appreciated your steady voice in this. It's why I asked you to bring me on in the beginning, because there were certainly a lot of people that's, fear, 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 and there's still a lot of those people out there, fear, 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 fear. But you were really pragmatic about there's things we can do, and even now there's things we can do. And let's talk a little bit about the fear that I think is sometimes out there that, okay, so we're 6 feet apart, so if somebody coughs, it's airborne, and can we breathe it through the air ducts? I know there's a lot of things we don't know, but primarily it's this contact, right? It falls on something. Can you walk us through really how we at least believe that most people are contracting COVID out in the public?
Sure. I mean, so for the most part, we're not living our lives 1 foot or 2 foot apart. Even in real life, we see that we don't often break that personal space, but yet folks still get COVID-19 despite that. So we know that it can be passed from droplet or aerosol, right from a cough or a sneeze. But I think we see more commonly that it's being contracted from that cough or sneeze, putting the droplet on a surface that someone comes along and touches an hour or 2 or 3 later, and then touches their face or their nose or their mouth, and boom, now they're infected as well.
Yeah. So that's why keep your hands off your face, right? Even
That's
wash them
it,
and
man.
wash them and wash them. So let's talk about the cases. So we had a little confusion recently where we had what was reported 4 cases in Taylor County, and then later it was 2 cases. And I know we can't get into the details, and this is one of those individual rights versus public service of we can't really get into the details because HIPAA and individual rights we have for people that are tested. But can we talk a little bit about what happened with the numbers, and then what do we know and can publicly share about the cases that are positive that we know in the county?
Here in Taylor County, we have two ways that we find out about positive cases. One way is our easy way. We've tested them here. We've run the test through the hospital. Our hospital and the health department have a very good feedback with each other, and so we directly learn our cases that way. The second way we learn our cases, however, is if someone is tested in a location that's out of our county. And when someone's tested out of the county, their test is reported first to the doctor who ordered the test, then secondly to the state, and then thirdly back to Taylor County. And so when you see those numbers change from 1 to 2 to 3 to 5, whatever, they don't necessarily reflect people that are in the county right now and being tested. They also reflect people who may be out of the county. Perhaps they're in a hospital. Perhaps they stayed in their aunt's house in Tyler County for the weekend. Something like that. So what happened here was that we got 2 cases reported to us from out of county, and that was in an evening. The next morning, we got a call from the state saying there was perhaps some laboratory error or some laboratory difficulty in those 2 particular tests that were done out of county. And they reran the tests, and those folks, fortunately, did not have COVID-19. And so we were able to change our number from 4 back to 2. Subsequently, we've had 1 more positive case, and we have a total of 3 now. So our numbers come from in the county and out of the county, and they're reported to us by the state, or if we do the testing locally from right here in the county. Now, I'll also answer your second question. Tell me again what it was.
Just from as much as you can share individually about the cases. Where did they
Okay,
contract
yeah,
it? What from contact tracing? Where were they? Those kind of things. I think people are really curious about that.
sure. So from a HIPAA standpoint, we're not allowed to say who is infected. We're not allowed to say where they live. And we certainly aren't allowed to say what retail establishments they've been in. That would just cause chaos. And it's not fair to the individual who is already fighting an illness to have to, perhaps answer questions from their neighbors and other citizens. It's just not fair and can't happen. So we basically just report demographic data like age, sex, We have reported whether we felt that they contracted it in the county or out of the county. Probably going forward, that's not going to be important anymore. COVID-19's in every county. It's just a matter of if it's detected there or not. It's difficult to know exactly how much information that is fair to release. Now, I will say that through our 911 center, the 911 center in Harrison County has all of the addresses of patients that have an infection, not necessarily COVID-19, but an infection in their data bank. And so when a 911 call goes out and the crew is dispatched, they know that they're going to perhaps a house where there may be an infection of some sort or another. Now, in 2020, that's probably COVID-19, but at least that allows them to prepare, and we don't divulge any private information for these folks.
Yeah, and this is where it's so different with our community, and I don't just mean West Virginia or Taylor County, but the United States community of individual rights, privacy. Whereas you look overseas somewhere where it's centralized government, and they'll tag you and bag you, and it's done.
Yeah.
But I gotta say, one of the things I think we all need to be mindful of. I'm trying. We don't want to stigmatize anybody who contracts COVID-19. It's like stigmatizing somebody for catching a cold. It's very difficult. For lots of folks, certainly in their jobs or whatever else, to be exposed to that. Now, if some of these knuckleheads having COVID-19 parties together and that kind of stuff, well, that's just ignorant. But that's not happening around here that I know of. I think people are following it really well, and that's probably a point we should make. The fact that there's 3 cases in the county means people are pretty well doing their job right now. What we're asking of.
Yeah, they really are, and our cases all directly relate to the workplace and out of county workplace. For our cases. So I think we've done a pretty good job. When I hear the first case of somebody contracting it at the Walmart or something of that nature, that's when I start to worry. And we just don't have that at this point.
Thank goodness. Let's hope we don't.
Thank goodness.
As this thing plays out, we're not over the hysteria, but you had the early phase and everything's you say, and then at the end it's going to be happy when it's gone and or it's controlled or contained or whatever it is. Right now we're kind of in those middle weirdness feelings of, okay, what's next? And so can you give us, and I know I'm asking you to pull out your crystal ball and tell us something that nobody knows. And I know you're not an epidemiologist, but you're our guy. And so I would ask you, what's next? I mean, I know we hear theories about maybe we let certain people out there at low risk once we're past the peak and there's kind of shooting for herd immunity, but how do we get there? What are you seeing, or what do you foresee may happen in terms of what our next steps are after this isolation phase and maybe how long it'll go?
Yeah, so our state health officer, Dr. Slemp, is very open with all of the county health officers. We have a conference call at least once a week, and at our last conference call, it was discussed quite a bit. What are we going to do as time goes on? It looks like our cases are flattening out, meaning that we're getting approximately the same number of cases each day. Lately 20 to 30, and we're not seeing a surge in the number of cases, and that surge is such an important word. Because if we don't see a surge in the number of cases, and then we can start to relax some of these mitigation strategies. And I think the first one that would relax would be the stand-in-place strategy, because we've got to get our workers back in and restore some economic stability. So I foresee that within the next couple weeks that there will be some relaxation of the stand-in-place order. It's tough for us here in Taylor County because we've got 3 counties just north of us, Harrison, Marion, and Mon, who have a lot more cases and probably need to have their stand-in-place order last just a little bit longer. But I think that in the foreseeable future, it appears that our cases are flattening off, that we're not going to have a surge, so to speak. I don't think our hospital systems are going to be overwhelmed. I think we have enough ventilators in the state for everyone who could possibly need one. And I think the time is going to show that West Virginia did a darn good job in mitigating COVID-19, and in the long run helped maintain their economic stability.
We take care of our own, man.
That's it.
So one of the things that I read early on, and I'm starting to see some more information now, and I'm not trying to create false hope or anything, but the virus changes. And one of the things that sometimes viruses do is become less lethal. And over time, it could be an expectation that as more people contract this and the virus mutates, that it might end up becoming less lethal. Are you hearing anything about that on the state level? Is there any communication of that possibility? I mean, is that a false hope, or is that something we can at least know that things are going to potentially change as the seasons change or as this virus goes on?
Viruses mutate. They all do. Sometimes those mutations become less lethal. I think that perhaps right now the current version of the virus that is being transmitted is a little bit less lethal than some of the earlier mutations of the virus that we had in our country. I don't want to create a false hope, though, because going forward there's often a round two, so to speak, and that could be down the road. And sometimes in that round two, the virus has mutated to a more lethal form. So we'll just have to wait and see. This is a great unknown right now.
Yeah, and to that point, not to throw a curveball at you, but so that when we talk about maybe releasing some of the stand in place, I mean, some of that doesn't that come with the ability to either test for antibodies or have more rapid testing? So if we had to immediately go back in, we could do those things. I mean, do we need to see some of that coming in before we're even going to think about a stand in place kind of being released, or what do you think about that?
Yes, I think the availability of rapid testing allows you to loosen or tighten regulations a lot more easily, and you can identify those clusters more quickly and can get those folks isolated, and perhaps have stand down orders as we do here in West Virginia, only in particular counties or even cities that have a cluster.
Yeah, makes sense. So one more, again, not to create false hope, but and anybody who contracts COVID-19, obviously they're going to be talking to their doctor. If they're in the county, potentially. So there's going to be individual prescriptions for what you need to do. But just so people have an idea, there's a lot of noise out there around this, and I almost always pronounce it wrong with this hydroxychloroquine. Malaria drug that potentially has some effects. Can you talk a little bit about some of the treatments that we're seeing that might have some hope? Again, I know there's a lack of science, but I mean, we're new. This is a brand new virus. And so just some of that. Again, I know everybody's individual treatment plan will be their own, but just generally speaking, can you speak to that at all?
Yeah. Hydroxychloroquine is a drug that's been around a long time. It's used for malaria. Chloroquine. Hydroxychloroquine is a drug that's used for a connective tissue disease called lupus. And so in the medical community, we're very familiar with it. It's a fairly safe drug if you're only using it for, a couple days, a short period of time. In the world, particularly in France, they began to try hydroxychloroquine on patients who were quite ill. And the initial study looked promising, but it's such a small study. I believe it was only 24 cases in this study. I mean, that's just too small. But that 24 cases spawned, its more widespread use, and I think President Trump jumped on the bandwagon as perhaps a non-physician might, and so we're all kind of on the bandwagon here in the United States. I think in the medical community, we see that it's not a cure. It may help in folks who have a more serious form of COVID-19 infection in which they develop something called ARDS, or adult respiratory distress syndrome. And in those cases, why not? It may help. Even if it doesn't, it won't hurt.
Yeah.
Okay. Time will tell us, Alex. I mean, we're studying it now, and down the road here, we'll have a much better idea if this truly was effective or if it was just grabbing at straws.
Yeah, I tell you, it's one of those things that just as people, again, if you're listening, watching 24-hour news, I don't care which end of the spectrum you're watching it, it's all about fear. And the reality is, I mean, this is dangerous. Maybe you take it serious, but it's not a complete death sentence for everybody. I mean, all these comparisons to the Spanish flu, and I get that, but we have come so far. I mean, we identified the genome, the whole thing was sorted out. We knew what it was. We're tracking it. There's drugs already in process. There's vaccines already in testing. I mean, it's unbelievable how quickly the medical and scientific community have reacted to this. And, who knows where we're going to be in another 3 months or 1 month or whatever it is. So I like to try to point this out, knowing that who knows, some of these things aren't going to your point, the data will show out in the end. But in the meantime, there's just a lot of promising things also happening along with, the shelter in place and the actions that people are taking. To that point, what is it, now at this stage, now we're what, 3 weeks into our stay in place, maybe on the fourth week. I don't, the weeks are, yeah, it's also,
Yeah,
it's been a long year this April, or
tell
this
me
March.
about it.
Yeah, that's, I'm sure. So what are you asking of folks right now? What's the ask? What can they do to help themselves, but certainly help the community, help the healthcare folks that are out there battling this thing?
Yeah, my message hasn't changed. I want folks to continue to socially isolate, continue to wash their hands when they go in and out of their house, use that sanitizer when it's available to them, and I want them to basically stay home if they don't have to leave home. I think I think the staying at home is just hard for people. And when I say stay home, hey, if you want to go take a ride in your car, if you want to go take a walk in the woods or downtown Grafton, do it. It's a good time to do it. It's nice and warm. It's not today maybe, but it's a real nice springtime right now. But don't come together in groups. It's just foolish. You just don't know who in the group has COVID-19 and just doesn't have the symptoms yet, and that's the problem. A lot of people are very infective one day before they have symptoms, and how do you know? You just don't. So we just have to stay apart for a little bit longer, and we'll all be better off for it.
Yeah, I think we said earlier, if you pass that on, that's not a bell you can unring. It's not something you
Right.
can just take back. So, Dr. Bender, I appreciate you being the signal in the noise, the calm voice in the middle of the storm. And I'm not trying, but there are so many people that are either fanning the flames or trying to blanket them over. And you've been a cool voice in our community, and I really appreciate what you're doing, and obviously all the rest of the team. We'll keep watching this, and I appreciate you coming back on and giving us some straight talk about what's happening. And obviously, we'll look to that in the future as things goes on. We'll see where this all plays out. But thank you. And if there's anything you need from us in the community, as we said earlier, they've really stepped up. I'm really proud of my community as a state, but certainly our little region here. I'm proud. I'm proud of what we're doing here, and I know we're going to continue to do what you guys are asking us to do. So thank you for all you're doing. I appreciate you coming on tonight.
All right. Thanks, Alex.